Hi, everyone. I am Chalonda Jones-Thomas, the CEO and President for the Thomas Institute of Health Professions. Welcome to our channel. In today's video, we will discuss window width, window level. Whether you are a student learning about computed tomography, also known as CT, for the first time, a healthcare professional looking to enhance your skills, or simply curious about medical imaging, this tutorial is for you. So grab something to take notes and let's get started. Have you ever looked at a CT scan and noticed how the same image can look completely different? Sometimes bone is bright, sometimes tissue stands out. The secret isn't the scan, it's how you adjust your window width and window level. In this lesson, I'll break it down so it finally makes sense. These two settings can totally change how your image looks on the screen, and understanding them is the key to image optimization and diagnosis. But here's something students often miss. The same CT data can be displayed many different ways to highlight different tissues. Before we jump in, let's do a quick refresher from our Hounsfield CT number lesson. Remember, every voxel in the body gets a CT number, or a Hounsfield unit, based on how much it absorbs the X-ray photons. Air is way down at about a negative 1,000 Hounsfield units. Therefore, the pixel on the scanner will be black. Water is 0. Therefore, the pixel on the scanner will be gray. And bone can be 1,000 or higher Hounsfield units. Therefore, the pixel on the scanner will be white. These numbers are the foundation for everything we're about to talk about. Our CT image consists of several shades of gray, from black to white. If you want more details on the Hounsfield unit, CT number, check out our teaching video, Hounsfield CT number, concepts, formula, and word problem solving. Let's talk about grayscale and bit depth. The image on the left demonstrates how many shades of gray are possible to be displayed depending on the number of bits used. For example, a 1 bit can only display 2 shades of gray, black and white. 2 bits allows 4 shades of gray, 3 bits gives us 8 shades of gray, 4 bits gives us 16 shades of gray, 5 bits allows 32 shades of gray, and 8 bits we can display 256 shades of gray. Now, here's why this is important for CT imaging. As discussed, CT assigns every pixel a number called a Hounsfield unit based on the tissue density. There are more than 2,000 possible Hounsfield unit values in the body. Imagine the CT scanner gives you all the Hounsfield units values from a negative 1,000 air to a positive 3,000 metal. That's a very huge number. This range is too wide for the computer monitors, which can only display about 250 shades of gray. And our eyes can only tell apart about 40 shades of gray. This is where window width comes in. It decides how many Hounsfield unit values will be displayed as shades of gray. Think of window width as the range of CT numbers that actually get displayed on your image. A narrow or short window width means you're squeezing that range down so you get fewer shades of gray, higher contrast. A wide window width or long window width spreads it out. More shades of gray, less contrast. Simple, right? Window level refers to the center point of the grayscale. It determines the image brightness. A higher window level shifts the window to show denser, brighter structures. A lower window level shifts the scale to display less dense, darker structures. For example, bone is dense and shows up bright on the CT image, whereas air is less dense and appears on the image as dark. Now let's compare the window width, window level to the smartphone camera analogy. Imagine you're trying to take a photo of the sunset. You adjust the camera settings to capture the perfect shot. Window width and window level in CT are the camera settings, but for X-rays. Window width is like the camera zoom. It determines how much detail you can see in the image. A wider window width shows more of the image, but the details might be fuzzy. A narrow window width shows less of the image, but the details are clearer. Window level is like the camera's brightness setting. It adjusts the brightness of the image. It helps you see the important features like bone or organs, but making them stand out from the surrounding tissues. Have you ever gone to the hardware store to pick out paint and seen those long paint color strips? Each one showing different shades of color, as seen here, from dark to light. Think of window width as the length of that strip. How many shades of gray you allow to be shown. A wide window width means more shades of gray, and a narrow window width means fewer shades of gray, more contrast. Now, window level sits in the center of your paint strip or your grayscale and highlights what you're trying to see. If your window level is too high, everything looks darker. If it's too low, everything gets washed out. Let's say you are setting the following windows for the brain. A window width of 80 and a window level of 40. Everything below 0, such as air and fat, is black. Everything above 80 will be white, such as dense bone. Brain tissue appears in soft gray tones, allowing small differences between gray and white matter. So why does this matter? Imagine you're looking at a CT image of the chest. If you use a brain window instead, for example, a window level of 40 and a window width of 80, the lungs would look gray and muddy. You won't see much detail in the air spaces. See image 1. But that same window is perfect for the brain because it allows you to see small differences between gray and white matter, which helps detect things like early stroke and edema. See image 2. Now, if you take that first chest image and switch to a long window, let's say window level of a -600 and a window width of 1500, the air spaces stand out clearly and you can evaluate lung pathology easily. See image 3. However, if you apply that long window to a brain scan, the image becomes almost useless. The brain detail disappear. See image 4. So notice how image 2 and 3 each use the right window settings for the anatomy being viewed. That's the key takeaway. Choosing the correct window width and window level makes all the difference in what the radiologist can actually see and diagnose. As stated earlier, some students often do not realize the same CT data can be displayed many different ways to highlight different tissues. For example, a radiologist may open the long window first to view the chest. This setting is designed to highlight the air and vessels inside the lungs. In this view, conditions like pneumonia, pulmonary embolism, or small airway disease stand out clearly. The long window gives excellent contrast between the air-filled spaces and the vascular structures, making it ideal for evaluating respiratory conditions. Next, the same data, the radiologist then switched to a soft tissue window. Now the focus moves away from the airways and towards the heart, liver, and great vessels. This window allows for better assessment of organ size, structure, and any abnormalities such as tumors, enlarged lymph nodes, or calcifications. By moving between these two windows, the radiologist is able to build a complete picture of the chest, ensuring that nothing important is overlooked. The long window reveals the fine details of lung pathology, while the soft tissue window highlights the anatomy of the mediastinum and the surrounding organs. I hope you enjoyed today's lesson. Remember, window width and window level aren't just shades of gray. They're tools to help us tell the right story with our images. Master them, and you'll become a more effective imaging professional. If this helped you, go ahead and like the video, subscribe, and turn on the notifications so you'll never miss out on any of our CT tips and tricks. Drop a comment below and tell me what topic you want to see next. Whether you're a medical imaging student preparing for the CT registry or a seasoned technologist needing a refresher course, we have the course for you. Visit thomashealthprofessions.com and explore all of our courses. Until next time, keep learning and keep advancing. Please feel free to connect with us on any of our social media platforms.